Welcome back to News 46. Chronic use of prescription pain medications known as opioids is increasing in the United States. Many patients who have not previously taken this type of medication are prescribed these drugs to help manage pain after surgery. A new study examined whether these patients are also at an increased risk for using opioids long term.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
Each day, thousands of surgeries are performed across the United States.
It's pretty normal to get a painkiller after you go home for your surgery and during your surgery.
What's not normal is to still be taking those pain medications many months after surgery. Dr. Eric Sun and his colleagues at the Stanford University School of Medicine reviewed the records of more than 641,000 patients who were not taking pain medication during the year prior to surgery. They had one of 11 common operations, including joint replacements, gallbladder removal, and C-sections during a 12-year period.
We wanted to see the year out after their surgery where they had increased risk of using opioids chronically compared to patients who didn't get surgery. Some opioid use is to be expected shortly after surgery, so we did exclude the first 90 days following their surgery.
Chronic use was defined as filling at least 10 prescriptions or more than 120 days worth of opioids during the first year after surgery.
Patients who didn't use opioid prior to surgery were at an increased risk for chronic opioid use following their surgery. The risks ranged from about 1.5 to 5 times, depending on the surgery. Overall, the risk is pretty low. It was about less than 1% for most of the surgeries we looked at.
Men and older patients were at an increased risk of chronic opioid use, along with patients with a history of certain medical conditions.
Patients who use benzodiazepines, that's a fairly common drug people use for anxieties. And also patients with a history of drug abuse and alcohol abuse are at high risk for chronic opioid use following their surgery.
Dr. Sun says physicians should be aware of this risk, even though the overall risk is small.
Physicians should closely monitor their surgical patients to see how much opioid they are or aren't taking, and just be aware that they may be at high risk for using opioids chronically.
Catherine Dolf, The JAMA Report.
Study authors say more research is needed to better manage the pain patients experience after surgery.
And local veterans honored our media last night at their meeting.
Deanna O'Donnell, please come forward. Thank you so much for the wonderful support you have given us.
The Disabled American Veterans recognized media last night during their meeting at the Night Communities Coalition. Honored were the Pahrump Valley Times, the Pahrump Valley Mirror, the veterans reporter Karen Jackson from K9 Radio, and myself, Deanna O'Donnell from KPVM TV and KA's Country Radio. I would like to thank the Disabled American Veterans and all veterans, retired and active military, for all they do every day. This is Deanna O'Donnell for News 46.
Officials are evacuating Piñon Hills, California due to the Cajun Pass fire. The town is home to over 7,000 residents and is only 12 miles west of Cajun Pass. Southern California firefighters are battling the wildfire that has driven more than 80,000 people from their homes and shut down major transportation routes. And they're saying a lot of air advisories out there.
Yeah, until Friday there's an air advisory right now because of that fire. And I even heard that the 15 freeway was shut down for a time.
Yes.
So hopefully that's reopened.
Yes.
We'll return in just a moment.